Healthcare wait times for Canadians just like you could be cut if we copied a policy from here in Ireland. Yeah, that's right. I flew across the world to find out more about this. Let's go. Like Canada, Ireland has a universal healthcare system, but one difference is that their patients have an option that we don't have, the Crossborder directive. Irish patients can go to other EU countries and the United Kingdom, pay for surgery, and then be reimbursed by their home country. This allows them to avoid long wait times at home. So for the past couple of days, I've been here checking out the Cataract Express bus. Basically what they do is they load up a bunch of senior citizens on a bus here in Cork, Ireland, and then they drive them all the way up to Derry in Northern Ireland, which is a part of the UK, and they get their cataract surgery done there. It's quick, it's easy, and it's a big help to these patients who afterwards don't have to worry about potentially going blind. It seems to me like a pretty simple idea. If you can't get the surgery done here on time, get it done somewhere else faster. But there has to be more to it, right? So I talked with the politician who set this whole thing up, Michael Collins.
We had massive waiting lists in Cork, massive waiting lists in Kerry, and people saw it as a solution. Not the greatest solution in the world, but it was a solution, and it brought back their sight. I hate to make it simple, but it's pretty simple. And you know, I often see a bus full of people nervous going up, coming back. They were telling me they were singing the whole way home. This could be copied anywhere. The Canadian government should look at this, as far as I'm concerned. If there's a massive waiting list, let's look across the border to see, can they take the flow of people? People have gone blind, that waited and waited for the country, for this country. Look, these people worked their butt off. They worked hard, they paid their taxes, they got up early in the morning, and they went out there and they just want one thing in return. I'm going blind. Can you get me my 25-minute surgery?
If it is really such a simple thing, why haven't we done anything like this at home? Well, in Canada, wait times are way too long. We even have people dying while waiting for cataract surgery. I had to see this Cataract Express bus for myself.
How are you? Good. Is that right? Yeah.
The sun just came up. I'm here at the Inver Fill Station. They call it a fill station instead of a gas station. This is where we're going to meet the patients. The bus is going to come here, and we're going to all hop in, and then we've got a 5-6 hour drive up to Northern Ireland. So I've got some coffee in me, and that's going to be helpful because it's rather early and the time change has been a bit to adjust to, but I think it's going to be a lot of fun, and I really look forward to meeting the patients and hearing their stories.
All the patients here, you're staying in the Everglades Hotel this evening. And as a gesture of goodwill from Kingsbridge Private Hospital, they're paying for the hotel stay. So you're staying free. So these patients go down, you'll be going into the hospital, 25-minute procedure, 1 hour recovery, and the coach is outside the door at approximately 2 o'clock to bring you home. Is that?
Pleasure, Mike.
God bless you.
Thank you so much.
6 weeks ago, I got terrible sore eyes, and they were watering. And I went to another optician, and she told me that I had cataracts and that I'd have to get them done.
What does that feel like when the doctor tells you it's going to be?
That's too long, like, you know, isn't it? We can't wait that length of time because you can go blind.
How does it affect your quality of life?
Everything is blurry. No matter if you put on a pair of glasses, you're still blurry, or you think there's ribs of hair in your eyes, and they're watery. My eyes are terrible watery.
Do you think there's something inside in your eye? You feel this thing kind of picking, like there's a stone or something, no grit.
Oh yeah.
Yeah, that kind of feeling.
Yeah, that can't be a nice feeling.
No, it's not, no. And then you can't see as good, and you think everything is kind of a darker colour.
Yeah.
Like you think everything is yellow, that your clothes, like if you don't put something on you white, you think it's like dirty and
Oh, yeah.
you can't see properly.
Even in the last year now, I went to the audiobooks because I didn't feel tired myself, but my eyes felt tired.
So let's talk about the cross-border directive. This is something that we could easily do in Canada. The policy is totally voluntary. You don't have to travel if you don't want to. However, even if you don't decide to travel, this policy still helps you. Every time someone leaves the country for care, everyone else behind them on the wait list moves up a spot. It's not often that you get a clear win-win like that. Patients could go across the border to the United States. Heck, they could even fly out here to Europe or to Asia. Patients could immediately get access to thousands of state-of-the-art health facilities instead of being stuck on wait lists in their home province. For example, in my home province of Saskatchewan, over 130 patients actually died waiting for cataract surgery just last year. It wouldn't be hard to organize a bus like this and send them across the border to Montana or North Dakota. And it could even be a help for more serious surgeries than that. Imagine how many hips and knees could get done, even life-saving surgeries like cancer treatment. Okay, we're not too far off now from Derry. I'm getting pretty excited to see the hospital. I've heard it's a state-of-the-art facility. So let's check back in later and I'll show you what it's like.
I know, what a journey. That is a marathon.
So from there, the patients went in and did their consultations, and I had a few hours to walk around Derry and check the place out. Of course, I had to have a pint or two. The next day, the hospital staff were hard at work. They had to get through all these surgeries, but it really seemed to go well. Here in Canada, it's not often you walk into a hospital and see a bunch of smiling faces, but that's exactly what I saw here. So tell me about the surgery itself. How did it go?
Great. Never felt a thing. And I was dreading it, but it was like a breeze.
How long does it take overall?
I say I wasn't in there 12 minutes.
Really?
If I was in there 50 minutes, I was in there a lot.
The journey is a bit long, but to me, I didn't mind it at all, you know. Just a little inconvenience, but I didn't care once I got my eyes on.
So it turns out it really was simple after all. It's a creative idea that doesn't take much to set up, and these patients have a new vision for their life ahead, one that isn't quite as blurry.
At the end of the week, they're like, I swear to God, at 90 years of age already, go dancing with me. They want to do disco dancing. They're so delighted they got their sight back. Some people didn't come back and started fighting with the husband. You had no right to paint while I was away. So they got their eyes, their new eyesight. They see the house, dancing, paint. It was a blur to them all along.
If you want to learn more about the Crossborder Directive and the many other ways they do healthcare better in Europe, head to secondstreet.org and don't forget to hit the subscribe button.